In our Health Watch report, the story of twin sisters with diabetes but using different treatment options. Local 3's Connie Fellman has more.
There are different treatments for different types of diabetes, even if you have the same diagnosis as someone else. In fact, even if you have the same everything as someone else, treating diabetes is not a one-size-fits-all approach. Identical twins, Pam and Pat, are about as full of life as you can get.
So that whole time I was completely normal, never had a problem. Completely normal.
But what they didn't know,
I did not know that I was diabetic. I felt good. I felt like I was healthy.
could have put those lives at risk.
She could have died because of the stroke and things like that.
Dr. Andrew Paul with Aurora Baycare Medical Center says diabetes left untreated can damage almost every organ system in the body.
But if we had missed it, and this had gone on for a number of years, both Pam and Patricia could have been at risk for heart disease, kidney problems, eye problems, other vascular problems.
Despite sharing the same genes, Pam and Pat were diagnosed with type 2 diabetes 14 years apart.
She could eat anything she wanted.
Yeah,
it was
anything I want.
Dr. Paul also says Pam and Pat illustrate perfectly why a diagnosis of diabetes doesn't have to mean a lifetime of pills or injections.
It's the exercise and diet control that have helped the most.
Even if they're not always perfect.
We decided we were going to go to the Y every day, so we've been doing that. And I watch my diet, she doesn't.
I'm a little more naughty.
Yeah.
Dr. Paul cuts them a little slack.
They want to live to be a good old age, and they're doing great things to improve the odds of that happening and having a great quality of life.
For these two, that quality of life includes travel.
We go on, vacations together all the time, and we have a ball.
I feel so much better. I have so much more energy.
Despite the current pandemic, both Pam and Pat say they feel confident with all the safety measures Aurora Baycare Center has in place.
I feel very safe. Very, very safe.
And they plan to continue being vigilant about their own health, like it or not.
So I like Dr. Paul a lot.
And probably Dr. Paul will never forgive me for that. Because now he's stuck with both of us.
Dr. Paul says some symptoms of type 2 diabetes include frequent urination and always being hungry or thirsty. If that describes you, it's a good idea to get checked out by your doctor.
I know some people are scared, but it's too dangerous not to go.
Yep.
Because your health is important.
Yep.
One more fun fact about these two, one of Pam's daughters is expecting the family's third set of identical twin girls. To learn more, you can call Aurora Baycare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Connie Fellman, Local 3 News.